I think one of the most common threads that runs along our past and current residents is that they're willing to grow with us. And actually, when we're actually developing our virtual booth space for ASHP, and that's our kind of our logo or motto is come grow with us, because we use our residency program to grow our pharmacy services. We've used it to grow into the ER in our organization years ago. We've used it to grow in our critical care unit. We're currently using it to grow in our ambulatory practice setting in oncology, outpatient oncology. So, we've also used it to develop our staff. When we first developed this program, we had no residency trained pharmacists on staff. Now through our program, we have a 5 members of our professional staff who have come through our program. So, we're looking to hire residents and select residents that are willing to kind of be on the cutting edge of the profession. Yes, they will be doing, some standard dispensing activities and whatnot, but typically, our residents are out doing the things that we want to develop more formally in our footprint for pharmacy services. So that's the type of candidate, that we're looking for is someone not, who's willing to kind of break out of the mold of traditional pharmacy practice and, help us grow into the more clinical and patient-centered roles that we eventually want to, move significantly forward with.
I would say they're all very self-directed. They come in and just start working immediately on their time management. They reach out for help when they need help. And I think the biggest thing that I'm looking for and that my residents have is just a positive attitude. They're coming looking for a challenge, and it is a challenging year, and everything's not going to go perfect. And we do want them to come to us, when they have challenges. Sometimes it's just a hard day, but then they bounce right back, because that's what, that's how you learn. You don't learn by everything being great every day, but if you can learn how to see your mistakes or some feedback in a different way, then you can learn from that and continue to grow.
Well, I think that their bedside manner, their that ability to communicate with patients, which is very evident with just in their ability to communicate with other people. And I think that comes across. That's something that definitely comes across in an interview setting, that you can kind of get a feel for what it would be like to be a patient on the other side of this person. The biggest thing is their patient, just that patient care aspect. I expect that people who work in the environment that we do are very personable and are able to carry on a conversation with people, and so I think that's the biggest piece. We can teach clinical skills, right? We can teach clinical knowledge, but sometimes it's challenging to teach some of those softer skills.
So I think common characteristics, of course, they have a strong pharmacotherapy knowledge, which is important. And it's good as a baseline coming in as a resident. Also, as far as, I would say areas for improvement is definitely teaching and research. So those are 2 big areas that we aren't really well versed on as a whole as pharmacists, and we're not trained to be teachers or researchers. It's more so clinicians. So that's like 2 big areas that I commonly see.